I understand, appreciate, have lived, right, that whole where you're just trying to get your next milestone from a product development and your next pre-submission with the FDA. You're just so myopically focused. But value analysis committees are such an important, I'm not going to say newer because it has definitely been around for a long time, but you really see, so many products have absolutely a mandate to have to go through value analysis committees. And these value analysis committees are multidisciplinary in the hospital system. So you're going to have, potentially quality members. You've got the kind of bean counter finance people. You've got, the clinical advocacies. You've got risk management. You've got kind of all of these different entities that are looking at your product. And if you can't really continue to make a compelling argument for why a hospital will allow you to get through that, essentially the valley of death at the hospital level, then it doesn't matter in so many ways, how much of a champion that physician is or that healthcare provider is that wants your product. If it can't meet the baseline requirements of a value analysis committee, it's not going to get put into the supply chain in the hospital, and it's not going to be able to be ordered. So, don't lose sight of that piece as such an important piece in the healthcare buying process for, really most, if not all, of the products that we are innovating against today. And think about building the story that you're going to be able to convey, and it's going to be a multidisciplinary story. So again, I love the fact that Sean said, go in and talk to these entities, get an understanding of value analysis committees, especially if you're a little newer to the space. Or maybe you've been an academic, or you've been some doctors that decided that they had some great ideas, because these are important pieces of the supply chain and the buying process to ultimately get your product bought.